A nice smile starts with good dental care. So joining us this morning from Simpson Dental, we have Dr. Kristen Simpson. Thanks for joining us.
Hi, good to see you.
Yeah, so talk to us about the Complete Dental Center.
Yes, well, a lot of times we have patients that come in and they've had treatment done here and there, and they don't have a goal for their whole mouth. Well, cavities spread from tooth to tooth, so until you treat the whole mouth as a complete picture, you might not get the best care available. So making sure that you have that end goal in mind when you're seeking dental care is definitely very important to do. So when you go, having a plan is an important thing.
It sure sounds like it. What about comprehensive care benefits? Tell us about these.
Yes, so comprehensive care is making sure that you're treating the mouth functionally as a whole. So making sure the bite fits together the way that it should, making sure you're replacing each tooth, making sure the joint is healthy. So there's so many things that come together in making sure that a patient has that comprehensive care available to them, and being able to have it all done in one place is definitely very beneficial to a patient, because once you start off with the plan knowing that you can get to that end result by having the same person do the treatment, really helps patients a lot, because sometimes they can get lost, going here or there, or, take a break and then forget to finish the treatment, and then that decay can spread. So it is very important to look at the whole mouth comprehensively and start with a treatment plan and make sure that you finish it.
Oh, yeah. So walk us through, what can patients expect during a comprehensive visit?
Well, so what we do at Simpson Dental, when patients come in for that initial exam, we like to meet them just in a consult room to kind of talk to the patient about their dental history, make sure we kind of establish a bond with them so that they feel comfortable in the dental office. A lot of times people can have anxiety going to the dentist, so we want to make sure that we meet them, establish a relationship with them. We'll give them a tour of the office just so they're comfortable in the environment, and then we'll get them into a treatment room to get the necessary images that we need. So we do a very thorough diagnosis, making sure that we get close-up pictures of each tooth. We take a CT scan to see the height and width of the bone, and then with all of this information, we're able to get several different comprehensive plans together for the patient so that they can have options to decide what they want.
Okay. Now, we all know emergencies happen. So if a patient has one, what do you do? What can they do? Can you work them in?
We do, yes. We allow time in our schedule to work in emergencies, because we know how dental pain can come on pretty aggressively, and you want it treated right away when it starts to happen. So we find time to get patients in quickly to be able to treat the emergencies, and more than likely we're able to treat it that day to either take care of, if it's a tooth that needs to come out, or a tooth that needs a root canal, or just a chipped tooth that might need a filling. Any of those issues we can take care of.
Yep, all those kind of things happen. Now, I hear a lot about crowns and veneers. Is that something that you do at Simpson?
We do, yes. Crowns and veneers are definitely something that we love to do. It's a cosmetic procedure, and we have our own lab, so we're able to have the lab technician work with the patient to get the crowns to match exactly to the smile line and look very natural to the patient. So with our own lab, we're able to even do crowns or veneers in a day. So we can take an intraoral picture of the tooth and be able to mill it on a machine that can then make it for that same day.
Can you also do dentures in a day?
We can, yes. So having our own lab is so great, because it can allow us to do so many different things. And with dentures, we can repair dentures, add a tooth to a denture, we can fix cracks in a denture, all in a day with our lab right there on site. So these are definite benefits to our patients.
Okay, and fillings, is that usually a one-trip visit fix, or how long does that take?
Yes, yeah, fillings. We have a Soleil laser that we can do minimal fillings, possibly without numbing. And then, of course, placing implants. We can do teeth in a day by placing the implants in the morning and give you those teeth connected to it by the afternoon.
Oh, that's
so
great.
Lots of things that we can provide to our patients, really giving comprehensive care.
Yeah, and like you said, a lot of these you can do in one day. That's great. So remind us where you're located.
Right.
And how can people get in touch with you?
Well, we're right off the Westmoreland exit in downtown Charleston, so you can either give us a call, 342-6162, or our website, wvsmiles.com, and there's a lot of information there.
Great. Dr. Simpson, thanks so much for talking with us on Studio 3.
Sure. Thank you.